Hello everyone. Now I'll tell you the second part of the antiviral therapy. Here we'll have antiretroviral drugs. These drugs active against the human immunodeficiency virus HIV, which is retrovirus. That's why these drugs called as the antiretroviral drugs. They are useful in prolonging and improving the quality of life and postponing complications of acquired immunodeficiency syndrome, AIDS, or AIDS related complexes, but do not cure the infection. So keep it underlined here, it's not curing the infection, but it will ensure the quality of life and the prolongation of life. The prototype drug under this category, a very much used drug under this category, is Zidovudine. This comes under the nucleoside reverse transcriptase inhibitors. In this particular virus, there is a reverse transcription process where the DNA is being formed through RNA. Usually, the normal phenomena is the DNA makes the RNA, means RNA synthesized by the DNA. But here, what this virus is doing is against the normal phenomena. It converts the RNA, DNA through the RNA, right? So that's why it's using the reverse transcriptase process, right? That's why this virus is one of the most lethal. And this is the structure. I have already discussed about this structure. Only need to understand few important proteins: GP41, GP120, P17, integrase enzyme. So these are playing important role in this process. Here also I have given you a little more insight of this particular virus, because once we know the structure well, it is easy to synthesize the drugs or maybe to discover the drugs against the AIDS virus. So if you see this black structure where the immature and mature viruses has been shown, if you see the mature virus, you can find the various type of proteins: P17, P24, P2, P7, P1, P6, and GP120. Where the word GP came, GP is a glycoprotein. So GP41, HLA class 2, HLA class 1, the lipid, and the other various enzymes and proteins. Like that, this particular structure has been made of. So if we inhibit these glycoproteins or these proteins, we definitely disrupt the structure of the this virus. And this is the life cycle of the HIV virus. I have already discussed in the previous slides. Here also almost similar life cycle has been shown. You can see how the virus get entered, binding with the receptor, and after binding, the CD4 cells are there. You can see the CD4 cells, because these ultimately it is inhibiting those CD4 cells after infected. You can see fusion coding reverse transcription process, by which it will makes the DNA, the RNA converts into DNA by the reverse transcriptase process, and then this DNA will enter into the nucleus. Then it will go for transcription process, makes the RNA, and then RNA again go with the translation process. Then the viral assembly and the new viral particle has been formed. So like the similar like other viruses, this also have the viral life cycle here. It is a thymidine analog. What is the, we are talking about the zidovudine. So it is a thymidine analog. The NRTI is act by competitive inhibition of HIV1 reverse transcriptase. So the enzyme, which is a reverse transcriptase enzyme, it is going to play a competitive role with it. Incorporation into the growing viral DNA chain causes the premature chain termination due to inhibition of binding with the incoming nucleotide. I hope you remember thymidine kinase, which was used by attacked by the acyclovir. Here it is, this drug is also a thymidine analog, right? So it's going to compete for that. If you see the mechanism, after phosphorylation in the host cell Zidovudine triphosphate selectively inhibits viral reverse transcriptase enzyme in preference to cellular DNA polymerase. Means it's not binding with the cellular DNA polymerase. When I say cellular, it means the host. So here it's not targeting the host cell DNA polymerase, while it is targeting the reverse transcriptase of virus. So the single stranded viral RNA in presence of the transcriptase enzyme converts into the double stranded viral DNA. That is the normal process. But this reverse transcriptase, which is going to inhibit it, you can see the reverse transcriptase which has done this miracle, converted the RNA into the DNA, will be inhibited by the zidovudine triphosphate because of having the similarity. You can see once this the double stranded DNA forms, it translocates to the nucleus and then integrated with the chromosomal DNA of host cell. That's a normal process, and then starts transcription of viral genome RNA as well as viral mRNA. Viral regulatory and structural proteins are formed. Finally, viral particle assembled and matured. So once the beginning itself, when the reverse transcriptase enzyme is inhibited by the zidovudine, this all process has been stopped there itself. So you can understand that zidovudine itself gets incorporated into the growing viral DNA and terminates the chain elongation. There is a resistance shown by the zidovudine. Resistance to zidovudine occurs by point mutations which alter reverse transcriptase enzyme. So once the mutation happens, then this is not the regular reverse transcriptase. It has been changed. So if it has been changed, but your drug structure is same, right? So your drug structure is same, but the reverse transcriptase is changed. So your drug is no longer going to compete with that, and it will not inhibit that reverse transcriptase enzyme. In the past, when zidovudine was used alone, more than 50% patients become non-responsive to zidovudine within 1 to 2 years therapy due to growth of resistant mutants. Adverse effects, this drug is also having a lot of adverse effects. Toxicity is mainly due to partial inhibition of cellular DNA polymerase. As I told you in beginning itself, it's not attacking mainly to the cellular DNA polymerase, but a partial inhibition is there, and by that some adverse effects are coming in. Anemia and neutropenia are the most important and those related adverse effects. Nausea, anorexia, abdominal pain, headache, insomnia, and myalgia are common at the start of therapy but diminishes later. Myopathy, lactic acidosis, hepatomegaly, convergence, encephalopathy are infrequent adverse effects. There are some interactions. Paracetamol increases the zidovudine toxicity, probably by competing for glucuronidation. You know, the paracetamol metabolizes through glucuronidation process, and so the zidovudine. Azole antifungals also inhibit AZT metabolism. Other nephrotoxic and myelosuppressive drugs are and probenecid enhances toxicity. Stavudine and zidovudine exhibit mutual antagonism by competing for the same activation pathway. There are some important uses of zidovudine. Is used in HIV infected patients only in combination with at least two other ARV drugs. So you need to add more antiretroviral drugs with zidovudine and then use it for the HIV patient infections in treatments. HIV RNA titer is reduced to undetectable level and CD4 count increases progressively. As I told you, this HIV virus attacks the CD4 cells, and CD4 cells are those cells which are responsible for the immune system of the body. So when the immune system goes down, there are a lot many other infections are coming in, and a patient get infected by even a very minute bacterias and viruses. Immune status is improved and opportunistic infections become less common, because when the CD4 cells will be protected, then of course it will fight against the normal infections. There is a sense of well-being and patients gain weight. AZT also reduces neurological manifestations of AIDS, and new Kaposi's lesions do not appear because there are certain brain neurological symptoms have been observed with the condition of AIDS. But when the AZT given, it can be protected. Mortality among AIDS patients is reduced. It has also been shown to show the progression of HIV infection, including escalation of ARC to full-blown AIDS. AZT, along with one or two other antiretroviral drugs, is the standard choice for post-exposure prophylaxis of HIV as well as mother-to-offspring transmission. Here you have some assignment of the drugs: diadenosine, stavudine, lamivudine, abacavir, nevirapine, and efavirenz. Must do these drugs as well. Don't leave them. Next category of drug is retroviral protease inhibitor, a very important drug in especially in today's scenario. I will tell you why. 5 protease inhibitors: indinavir, nalfinavir, sequinavir, ritonavir, and lopinavir are very much in use. An aspartic protease enzyme. Now you understand the mechanism how these drugs are important here. An aspartic protease enzyme encoded by HIV is involved in the production of structural proteins and enzymes, including reverse transcriptase of the virus. Okay, so because this enzyme is needed to make all those viral proteins. The large viral polyprotein is broken into various functional components by this enzyme. So what happens when the protein synthesis is going on? One big protein particle has been formed, and then you need to break it off. The splicing process by which you have to break it off. Once you break it off in various sections, then various proteins are formed. So this particular enzyme does that, right? So if you stop it, these all process will stop. This protease acts as a late step in HIV replication. That is maturation of the new virus particle. Means you have seen that some drugs acting on different level. This acts on the last level where the replication happens and the virus is going to get mature. So in that process it acts. So maturation of the new virus particle, when the RNA genome acquires the core protein and the enzyme. So in that time when the core protein is going to get assembled into a mature particle, this protease acts that to help them out, right? So if you stop this protease enzyme here, this all process will get stopped. During the later stages of the HIV growth cycle, the Gag and Gag-Pol gene products are translated into polyproteins. Now, here the name of gene is given, which is responsible for making the proteins for virus, and these become immature budding particles. The HIV protease is responsible for cleaving these precursor molecule to produce the final structural protein of the mature virion core. By preventing post-translational cleavage of the Gag-Pol polyprotein, protease inhibitors prevents the processing of viral proteins into functional conformations, resulting in the production of the immature non-infective viral particles. So what happened? There is a post-translational cleavage, because unless until there is the protein synthesis process where post protein synthesis modifications are there. So in this modification time where the post translational cleavage you can call it, because there you need to cut it into different pieces and to make the different functional proteins. In that process, if you are preventing that enzyme, this process will get affected, and then prevents the processing of the viral protein. Then these proteins will won't form, and then the all required proteins are not available to make a complete or a mature viral particle, and then the immature viral particle will be formed. And then immature particles will definitely die soon. So I hope you understood the mechanism of this here. So the large viral polyprotein synthesized in the infected cell is broken into various functional components by the protease enzyme, and this protease enzyme is going to be inhibited by the protease enzyme inhibitor drugs. So here this is also causing some resistance contraindicating the monotherapy. So because of monotherapy or single use of the drug, resistance may be more common. Some of the most, how it happens now, I'll tell you. Some of the most common mutations conferring broad resistance to protease inhibitors are substitutions at, now it's telling the mutation is making the resistance, and mutation happens where? At 10, 46, 54, 82, 84, and 90 codons. Right? Its numbers are given where it is actually happening in that which particular gene. The number of mutations may predict the level of phenotypic resistance. Phenotypic resistance means the uh, changes in the genetical structure has brought about the functional changes or the physical changes in the virus particle or the drug. The I50L substitution emerging during atazanavir therapy has been associated with increased susceptibility to other protease inhibitors. Darunavir and tipranavir appear to have improved virologic activity in patients harboring HIV-1 resistant to other PIs. Now here are some ADRs of protease inhibitors. A syndrome of redistribution and accumulation of body fat. This is a here it's a very much a big problem related to the fat metabolism, and because of that it results to a central obesity, right? Dorsocervical fat enlargement, right, on the shoulder, near to shoulder, a lot of fat get enlarged, which is called as the buffalo hump. Peripheral and facial wasting means the face will become very big. Breast enlargement and a Cushingoid appearance, like Cushing syndrome symptoms, like that appearance will be there, has been observed in patients receiving antiretroviral therapy. Protease inhibitors have been associated with increased spontaneous bleeding in patients with hemophilia A or B. An increased risk of intracranial hemorrhage has been reported in patients receiving tiprenavir with the ritonavir. The concurrent use of sequinavir and ritonavir has recently been found to be associated with QT and PR interval prolongation. So, sequinavir and ritonavir together, not very safe combination because of the changes in the ECG. QT prolongation may result in life-threatening torsade de pointes arrhythmia. This is a one condition called torsade de pointes or pointes in arrhythmia. Gastrointestinal intolerance, asthenia, headache, dizziness, limb and facial tingling, numbness, and rashes. It is noteworthy that the potent CYP3A4 inhibitory properties of ritonavir. It is noteworthy that are used to clinical advantage by having it boost the level of other PIs agents when given in combination, right? So CYP3A4 inhibitory activity. So when CYP3A4 will not be there, then the metabolism of these drugs will be affected. It means their effect will be boost and prolonged for little more. That's why it's called as the boost effect. Here also you have some drugs to cover by yourself. Atanzinavir, durinavir, fosemprenavir, indenavir, lopinavir, sequinavir, ritonavir, and teprenavir. I had told you that this particular class of drugs are very much used for the COVID-19 treatment. As you know, the anti-HIV drugs have been used. So lopinavir and ritonavir combination have been used a lot nowadays. In started from the hospital by Jaipur, and later it has been used by all over India, and now the most part of the worlds are also utilizing the lopinavir and ritonavir combination, as well as one drug called as remdesivir, Remdesivir. So remdesivir. So remdesivir. This drug is also very potential antiviral drug. It has been tested already in 2016 for the Ebola virus infection treatment and successfully treated lot many patients. Nowadays also for COVID-19 infections, this drug is used, and it has been found that it is a, very good response against the corona family of viruses. So please cover up these drugs as well. Now, just a small details. I'll give you some more drugs which are adjuvant therapies, as an adjuvant therapies has been used, called as fusion inhibitors or entry inhibitors. Like these drugs are inhibiting at the first phase itself, where the virus is going to fuse with the host cell, or they are trying to entry into the host cell. That's why I call it as fusion inhibitor or entry inhibitors. Infuviritide and Maraviroc. This recently introduced HIV derived synthetic peptide acts by binding to HIV-1 envelope glycoprotein GP41 and preventing fusion of viral and cellular membrane. So you remember the GP41 that was on the envelope? So they bind it there and inhibiting that. Entry of the virus into the cell is this thus blocked. It is not active against HIV-2. Viral attachment to the host cell entails binding of the viral envelope glycoprotein complex GP160 consisting of GP120 and GP41 to its cellular receptor CD4. This binding induces conformational changes in GP120 that enables access to the chemokine receptor CCR5 or CXCR4. Chemokine receptor binding induces further conformational changes in GP120, allowing exposure to GP41 and the leading to infusion of the viral envelope with the host cell membrane and subsequent entry of the viral core into the cellular cytoplasm. So, by inhibiting these glycoproteins, it is actually enabling what called disabling this virus to bind to the host cell and to get into the cell. Another category called as the integrase strand transfer inhibitors, that's called reltigravir. Reltigravir is a pyrimidine dione pyrimidinone analog that binds integrase. So, you know, the integrase enzyme was there, which helps in the integration of the viral nucleic acid. So it acts on that enzyme, and that's why it is disturbing the integration process, and so the viral maturation process. A viral enzyme essential to the replication of both HIV-1 and HIV-2. By doing so, it inhibits strand transfer, the third and final step of pro-virus integration, thus interfering with the integration of reverse transcribed HIV DNA into the chromosome of host cell. So very, very important role what it's playing, particularly on the very important process where the integration is happening, and then the viral DNA is going to incorporate into the chromosome of the host cell. That process is also stopped if we inhibit this enzyme. Some new and investigational antiretroviral agents names are given here. Please go through and find out which are some new one. Maybe they all are in the phases, different phases of clinical trials, or maybe in the initial phase into the market. Here also you have some assignments which comes under the different category of drugs. Interferon alpha, oseltamivir and zenamivir, amantadine and amantadine, pelivizumab, imiquimod, ribavirin, edifovir and edifovir dipivoxel. So please make a note that these are very important drugs, right? And interferon alpha, maybe you can get a 5 marks question on it. So please go through with this, as well as you need some short questions you have to prepare for the as a treatment of HIV, treatment of hepatitis B, treatment of influenza, as well as note on heart. This is called highly active antiretroviral therapy. So, very important note on heart is required. So, please go through and prepare these things. These are the references used for this presentation. Thank you so much for listening me this whole account on the viruses, type of viruses, different drugs, and virus life cycles. Please go through and understand and keep me posted. Thank you very much.